Chronic cough increases the pressure in the abdomen, so that increases your risk as well. Urinary incontinence in itself means an involuntary leakage of urine. That actually means that the patient cannot control when the urine comes out. Urinary incontinence after childbirth, the most common is actually stress incontinence. When I say stress, it's not because the patient is stressed, but it's because of an increase in the intra-abdominal pressure, which means that they will have a leakage of urine when they cough, when they sneeze, when they carry something heavy and things like that. So that is called stress incontinence. Now, incontinence after childbirth is actually very, very common, unfortunately. About 4 out of 10 women actually have incontinence, although it is not much spoken about because they are a bit shy of this condition. Now, 50% of women, it's been shown in studies that 50% of women who had a childbirth by vaginal delivery versus that women who had cesarean delivery. So those who had vaginal delivery, 50% actually had incontinence. So it's actually a very, very common condition which is not spoken about much. So it's great that you're talking about it today, and it's actually something that we can treat. So a lot of women shy away, or they don't come forward to discuss this problem even with the doctors or even their family members, because they just feel shy. So it's good that we are talking about it today, because you see all these ladies out there, you must understand that this is quite common, and it is actually, most of the time, it recovers on its own within months to sometimes even a year. But if it does not recover, there is actually other treatment modalities for it, and you should come forward and get help. When we talk about childbirth in connection with urinary incontinence, there are many factors. One of the main factors is the hormonal changes that are happening actually in the woman's body when they are pregnant. Yeah? So we have certain hormones like progesterone and things like that actually cause a little bit of laxity or relaxation of the muscles, especially of the pelvic floor muscles. And these pelvic floor muscles are the ones that are supporting the bladder, supporting the uterus, right? So when these muscles are actually a bit weak, okay, relaxed rather, because of the weight of the uterus with the baby, a growing baby, it increases in weight. All this relaxation can cause the patients to actually have laxity and then end up with incontinence. There are many other factors. One of it is what we call parity. Parity means how many children you have had. A lot of times, if you have had multiple vaginal deliveries and all your babies are of a good size, then of course your risk is higher as well. Then if you have had an instrumental delivery, that means a forceps-assisted delivery or a vacuum-assisted delivery, then the risk of having this kind of incontinence is also slightly higher. Other factors are like your body weight in itself, pre-pregnancy weight. If your pre-pregnancy weight, you have a slightly higher BMI, you're a bit more on the heavier side, then the risk factors are also higher, because we know that because of the laxity of the muscles. Now, if you're not physically active prior to pregnancy, then of course the muscles will be weak and it will be lax, and so it will contribute further for somebody to develop stress incontinence as compared to somebody who's always had an active lifestyle, always exercising, keeping the muscles toned, then of course the risk is lower. Other factors are like patients who are smoking, because when you smoke, you tend to have chronic cough. Chronic cough increases the pressure in the abdomen, so that increases your risk as well. So these are among some of the other contributing factors that can lead to somebody actually having stress incontinence following delivery. The first thing that I think we need to talk about when we talk about the management of urinary incontinence is how can we try to reduce our risk initially itself to get the urinary incontinence. So the first thing is, like I said, if we can maintain a good optimal BMI, which means that we have an active lifestyle, we are exercising regularly, keeping our muscles toned, our abdominal muscles and our hip muscles. So if we can keep these muscles well toned, then of course that will reduce the risk. If we are smoking, we need to cease smoking, right? So that we don't have this issue of chronic cough. Now, in pregnancy and also after pregnancy, there is something called pelvic floor exercises, which is like Kegel's exercises. So basically, is to strengthen these muscles that actually support the uterus, support the bladder. Now, some people may think that you only do Kegel exercise when you have a problem. You only do Kegel exercise if you have urinary issues. No, that is a wrong concept. You should do your Kegel exercises pre-pregnancy. Continue doing it in pregnancy and continue to do it post-pregnancy, especially when you have a vaginal delivery, right? Whether or not you experience the symptoms, sometimes the symptoms may be delayed. Not everybody gets it immediately after delivery. Maybe a few months down the line, they may develop the symptoms. So it's good that we practice these Kegel exercises. I'll just tell you one of the simplest exercise that you can do, which I think most people will teach you, whereby you just try to hold your urine. Yeah? You take a deep breath, you hold your urine, you count about 8 to 10 seconds. Hold the urine, hold it tight, and then release. You do that 3 to 4 times in one sitting, and you can do that multiple times. So this is a very, very easy exercise that you can do. You can do it on the go, you can do it at work, you can do it while you're sitting, while you're cooking, anything that you're doing, as long as you pay focus on doing that. That in itself strengthens the pelvic floor muscles. And also don't forget some abdominal tightening exercises as well, yeah, because we need the hip muscles and the abdominal muscles to help with the pelvic floor strength. Now, other than that, there are other things that we can do. For example, our diet modification. So we have to have a healthy diet so that we can shed our pregnancy weight that we have gained, okay, to go back to our BMI. Certain foods or drinks like caffeinated drinks, sodas, spicy food, all these are bladder irritants, yeah, which can actually reduce the irritation of the bladder, and so it reduces the symptoms. Okay, now other than that, things like what we call bladder retraining, meaning that we know we have this issue. Now what are we going to do? We train our bladder. We say, okay, now we're going to time and schedule our urination. At what time we're going to pass urine. What time we're going to pass urine, right? So as we go along, we start prolonging that time between one urination and the other. So we are retraining the bladder when to pass urine and strengthen the bladder back. So these are some of the things that we can do. Other more invasive or slightly more invasive things is like maybe some people have heard of this percutaneous tibial nerve stimulation that can be done. Usually they put a needle somewhere near the ankle that stimulates our tibial nerve from the leg, and that goes and stimulates the sacral nerves, which are actually controlling the bladder, and that sort of like blocks out some of the impulses to prevent the symptoms. So there are many things that we could do. So the simplest would be pelvic floor exercises, diet modification, keeping the exercise going pre-pregnancy, in pregnancy, and postpartum, and most of the time this can be sorted. If at all your symptoms persist despite all this, please get professional help, because there are things that we can recommend, and there are even surgeries that can be done to help you. Please do not suffer in silence.